All right, guys. So the number one most common injury in running distance is patellofemoral pain syndrome. And that basically means pain in the front part of your knee, in between where your kneecap meets the femur. So in that little groove on your femur, your kneecap kind of sits right in there. As you flex your knee, it's going to ride up. And as you straighten it, it's going to come down. That is our most common area where you're going to see injuries in runners. The cornerstone of rehab for patellofemoral pain syndrome is strengthening the hips and the knees. So when we look at the hips, the ones that are really, really important to strengthen with runners are the hip abductors, so the ones that are going to bring the hip out, and then the hip external rotators, which will twist the hip like this. And then along with that is the glutes, the hip extensors. So those are your three that you cannot miss if you're trying to strengthen around the glutes. So another thing you can think about is the mechanics while you're running, and we think about this as movement retraining. So we want to make sure we're not getting too much adduction or coming across with the hip along with internal rotation, and then that's going to lead to valgus collapse at the knee. So the stronger and better we can get at controlling that, the more it's going to transfer to our movement. But sometimes some runners need a visual cue to actually change that pattern when they're running. I have found over the years this is really, really hard to actually implement for runners. So I would start to strengthen those tissues first and then see if that improves the knee pain, and that might get you away from actually having to change your gait or think about those other things. Another thing you can do is increase your cadence. So if you can increase your cadence around 7%, that will actually decrease the amount of kind of stress that's going through the heel up to the knee. And that can be something for people with patellofemoral pain syndrome that can help them to keep them running. You can also think about where you are landing with your stride. A little bit more of a midfoot or forefoot landing does tend to perform better for knee pain, but those do come with an increased risk of things like plantar fasciitis and Achilles tendinopathy. So you've got to weigh your options there. And then the last thing you can do for movement retraining is just think about landing softer. So that will actually, usually it'll help people to stop from overstriding and then kind of cranking on their heel all the way up to the knee. And if they think about landing softer, it'll actually usually bring them to a little bit more of a midfoot strike pattern. All right, now with any injury, it's important that we think about load management. So we got to take into account how much load can your tissues handle and how are you building up that tolerance. So then we go back to strength training. That's obviously very important. But then also when you're increasing miles, you got to make sure that like you're not doing it too quickly, because if you do it too quick, then those tissues don't have time to adapt, and then you're going to wind up with worse knee pain than when you started. There's also taping techniques that can be used. We can use some manual therapies. We can use different orthotics.